Hello friends, today we are going to discuss about sample care plan discussion is about acute pain. Nursing assessment. Assess the pain level, location, type, duration and aggravating factors. The pain scale 0 is no pain, 1 to 3 mild pain, 4 to 6 moderate pain, 7 to 9 severe pain, 10 worst pain. In diagnosis. Acute pain related to physical injury, example as fractures, wounds, nerve damage, inflammation, and surgical incision. Planning to relieve pain, administer analgesia as prescribed. Patient keep comfortable position. Patient encouraged to use non-pharmacological methods for relieve pain. Take feedback after given medication. Give health education about pain management. Implementation. Administered analgesia as prescribed. Patient kept comfortable position. Patient encouraged to use non-pharmacological methods for relieve pains. Taken feedback after given medication. Gave health education about pain management. Evaluation. Pain level. Pain is reduced more than earlier.